Okay, let's just be honest for a second. Finding a tick on your dog, your cat, it's never exactly fun, is it?
No, definitely not. It always gives you that little jolt.
Yeah, or sometimes, you just notice your pet seems, well, off. Maybe limping a bit, not quite themselves. And your mind just leaps, doesn't it, to tick-borne stuff.
Lyme disease often jumps right to the top of that list for people.
Exactly.
Yeah.
So, welcome to this deep dive. We're doing this specifically for you, using all those sources, the articles, the research notes you sent over.
hmm
Our goal today isn't just to skim them. We want to really unpack these specific materials together, pull out the really essential knowledge, the useful bits, so you feel genuinely clued in about Lyme disease in pets.
And get you there fairly quickly, but without skipping the important details.
Right. Okay, let's unpack this.
Sounds good. And looking at your sources, the first thing really is nailing down what we're talking about. It's Lyme borreliosis.
Borreliosis, right.
And it's caused by this specific bacteria, Borrelia burgdorferi. It's actually kind of interesting looking, like a tiny corkscrew. It's a spirochete.
A spirochete. Okay, so that's the culprit. But how does it actually get to our pets
Right.
from out there? What do the sources say about how it's transmitted?
Right. So the key player here is the tick. Your sources are really clear. Transmission happens through the bite of an infected black-legged tick.
The deer tick, Ixodes scapularis.
That's the one. And here's something really, really important. Your sources highlight something practical for pet owners.
Oh, yeah. What's that?
It's about how long the tick needs to be attached. This is critical.
Okay.
The bacteria, Borrelia, aren't transmitted instantly. The tick usually has to be attached and feeding for, well, the sources generally say about 24 to 48 hours.
Wow, okay. 24 to 48 hours. That's actually quite a window.
It is, and it's absolutely key when we start talking about prevention later on. That time frame makes a huge difference.
Makes sense. Okay, so which pets are most likely to get sick from this? Does the research you shared point fingers?
Yeah, it points pretty strongly towards dogs. They're diagnosed with, like, clinical Lyme disease much, much more often than cats.
So cats can get infected, but they don't really get sick.
Exactly. They can be exposed. They might even test positive later, but actually showing signs of illness. It's reported as being quite rare in cats.
Interesting. And geography. That plays a big part, right? Where you live matters.
Oh, absolutely.
Okay.
Your sources definitely map this out. Lyme disease isn't everywhere equally. It's much more common in certain specific regions.
Like where?
In North America, we're talking mainly the northeastern U.S., the upper Midwest, and also parts of the Pacific coast. And then there are hot spots in Europe, too.
Yeah.
So yeah, location, location, location. If you're in one of those endemic areas, the risk is just higher.
Right. So the tick bites, maybe it stays on long enough, the bacteria get in. What actually happens inside the pet's body then? How does it cause problems?
Well, the sources explain that the bacteria, those spirochetes, they don't just stay put. They travel through the body and tend to settle in certain places, especially the joints.
Ah, the joints. That explains the lameness later, I guess.
Precisely. But it's not just the bacteria themselves causing all the trouble. It's often the pet's own immune system reacting to them. That immune response causes inflammation. And that's what leads to many of the signs we see, like the joint pain and swelling. Sometimes it can even become a chronic thing.
And the symptoms, I remember seeing in your notes, they can be all over the map. Like some dogs show nothing.
Exactly. That's a huge point your sources make. A lot of dogs get exposed, their bodies make antibodies, they might test positive on a screening test, but they never actually get sick. Totally asymptomatic.
But when they do show signs, the sources mention kind of an early phase, usually a couple of months after the bite.
Yeah, typically looking at maybe 2 to 5 months later.
Yeah.
And often, the signs are related to those joints we mentioned.
Okay, what kind of signs?
The classic one described is this shifting leg lameness. They might limp on the front left leg one day, then maybe it seems better, but then the back right leg starts bothering them.
Huh. Shifting lameness. Sounds noticeable.
It can be. It's because of polyarthritis, inflammation in multiple joints. But you might also just see vaguer things, like a bit of a fever. Maybe they're just lethargic, not wanting to eat as much. Maybe their lymph nodes feel a bit swollen.
Yeah, that shifting lameness sounds kind of specific, but fever, lethargy. Gosh, that could be almost anything.
Exactly. Which is why diagnosis can be tricky.
So what about the more chronic or really serious signs? The sources mentioned those too.
Right. So sometimes the lameness keeps coming back or it just persists. You might see more obvious joint swelling or pain, especially the sources note, in the wrists, the carpus, or the knees, the stifles.
Okay, and then there's the really scary stuff. Thankfully rare, but it was definitely in your materials. The kidney problems.
Yes, that's Lyme nephritis. And your sources are quite clear. This is a very serious complication. It can come on fast and be really devastating.
Leading to kidney failure.
Sometimes, yeah. It can cause something called protein-losing nephropathy, where the kidneys leak protein, and it can progress to outright kidney failure. The signs are different than like drinking and urinating a lot more, vomiting, losing weight, maybe even getting puffy from fluid retention, edema.
Wow. That sounds severe.
It is. And the sources also mention, though very rarely, some neurological or even heart issues linked to Lyme in some cases.
Okay, so with this huge range, nothing at all, to shifting lameness, to kidney failure, how on earth do vets figure it out? Your sources suggest it's not always simple.
No, it's definitely not straightforward, precisely because the signs can be so nonspecific or even absent. So the sources really emphasize needing a comprehensive approach.
Starting with the basics, I assume, like talking to the owner, checking the pet over.
Absolutely. The clinical history is vital. Has the pet been in a risky area? Any known tick bites? What symptoms have you actually seen at home? Then the physical exam, checking for fever, swollen lymph nodes, painful joints, lameness.
And then you get into the tests, the blood tests. And this is where, according to your sources, it gets a bit nuanced. They mention tests for antibodies.
Yes, the serologic tests. Things like the SNAP-4Dx, which many vets use in-house. It screens for Lyme, and a few other tick diseases or specific Lyme SNAP tests. These look for antibodies, particularly one called C6.
Right, C6. And here's that crucial point again from your materials. A positive C6 test just means exposure, right? Not necessarily active disease.
Exactly. That's probably one of the most important takeaways. It causes so much confusion. A positive C6 antibody test confirms a dog's immune system has seen the Lyme bacteria at some point. It absolutely does not automatically mean the dog is sick now or needs treatment now.
So what happens after a positive screening test then?
Well, the sources often mention following up with a quantitative C6 test. That measures the level of those antibodies. A very high level might be more suggestive of an active infection, especially if there are symptoms. Sometimes a Western blot test might be used for confirmation, but it's maybe less common routinely now. But the key thing is, many dogs test positive and are perfectly healthy.
Okay. So positive test equals pay attention, not panic. What other tests might come into play if the dog is showing signs?
Your sources mentioned PCR tests, which look for the bacteria's actual DNA. You can run it on blood or joint fluid.
Is that helpful?
It can be. But the sources note PCR for Lyme in dogs isn't super sensitive, so a negative doesn't rule it out. And even a positive interpretation can be tricky. If there's concern about kidneys, then definitely a urinalysis looking for that protein loss and blood chemistry panels to check kidney function are vital. Maybe even analyzing fluid drawn from a swollen joint.
Right. So let's say, based on everything, the history, the signs, the tests, the vet decides, okay, this is active clinical Lyme disease. What's the treatment plan look like based on your sources?
The standard is antibiotics. Doxycycline is usually the first choice, typically given for about 4 weeks.
4 weeks, okay.
Yeah, a full course. Amoxicillin is an alternative or sometimes an injectable antibiotic called cefovecin if doxy isn't right for that dog.
And how quickly do dogs usually feel better?
That's the encouraging part. Your sources generally say that for uncomplicated Lyme, mostly the joint issues, dogs often show a pretty dramatic improvement quite quickly after starting antibiotics. Like within 48 to 72 hours, the lameness often gets much better.
That's pretty fast. Is there other supportive care involved?
Yeah, depending on the situation. If there's significant joint pain, pain relievers or anti-inflammatories like NSAIDs are often used. If the dog is really feeling lousy or dehydrated, maybe some fluid therapy. And for those really serious kidney cases, it's a whole different level of support, special diets, drugs to manage the protein loss, blood pressure meds. It gets complex.
Thinking about the long term, what's the prognosis? How do they generally do after treatment?
For those uncomplicated cases, the ones with just the joint signs mainly, the prognosis is usually excellent if they get treated promptly with antibiotics. Most dogs make a full recovery.
If the kidneys are involved, that sounds like a different story based on your sources.
It really is. That Lyme nephritis, the sources consistently describe the prognosis as guarded to poor. It can be aggressive, hard to manage effectively, and unfortunately the outcome often isn't good.
Which just brings us back so strongly to what the sources emphasize next. Prevention. That seems like the absolute best strategy.
Absolutely. Hands down. Preventing the ticks from biting or from staying attached long enough to transmit. It's far, far better than having to treat, especially given the risk of those severe complications.
So what does effective prevention look like according to these materials? What are the key parts?
It's really a multi-pronged approach. Number one is good tick control products, the acaricides.
Like the spot-ons or the chewables?
Exactly. Topical treatments, oral medications.
Yeah.
Your sources mention common ingredients like floralaner, afoxolaner, ceralaner, fipronil. And tick collars, like the Seresto collar, are another option mentioned.
But just putting the product on isn't enough, is it?
No, the sources stress that. You need to combine it with basically being vigilant yourself, doing daily tick checks on your pet, especially after walks in woods or tall grass. Feel all over between the toes and the ears.
And remembering that 48-hour window.
Crucial. If you find a tick, remove it promptly, ideally well within that first 24 hours. That can prevent transmission, even if the tick somehow got past the product.
What about the Lyme vaccine for dogs? Is that recommended?
Yes, the sources say vaccination is available, and it's generally recommended for dogs living in or frequently visiting those high-risk endemic areas.
How does that work?
Usually it's an initial series of 2 shots, a few weeks apart, and then annual boosters are needed to maintain immunity. But, and this is important, the sources make it clear that vaccination works best alongside the tick control products and the physical checks. It's an added layer, not a replacement for tick control.
Okay. Any tips for managing the environment, like your yard?
Yes, some basic things. Keep your lawn mowed, trim back brush, makes it less tick-friendly. Try to avoid walking your dog through really dense woods or high grass, especially in spring and fall when ticks are most active. Yard sprays are an option too, but you need to be careful they're pet safe.
Gotcha. Now, going back to tats for a second, you said clinical Lyme is rare. So do they need all this prevention?
Well, your sources clarify because there are other tick-borne diseases cats can get sick from. Plus, you don't want cats bringing ticks into the house where they could bite people or other pets.
Ah, right. Which leads to that question people always ask. Can I get Lyme disease from my dog?
Yeah, and the sources are very clear on this. No, you cannot get Lyme disease directly from your pet. It's not transmitted through saliva or petting or anything like that. But your pet can act like a taxi service for infected ticks. A tick could bite your dog, feed for a bit, maybe get the bacteria, then drop off in your house and later bite you. So controlling ticks on your pet helps protect the whole family, not just the animal.
Okay, that makes sense. So let's try and sort of wrap up the key things we've pulled from these sources. We've got Lyme disease caused by that spirochete bacteria, Borrelia burgdorferi.
Transmitted by the black-legged tick, the deer tick.
And crucially, that tick needs to be attached for like 24 to 48 hours. That window is key.
And the symptoms. Hugely variable. From absolutely nothing to that shifting lameness and those rare but really serious kidney issues, Lyme nephritis.
Right. And diagnosing it is tricky. Those non-specific signs, plus, and this is so important, a positive antibody test just means exposure, not necessarily active disease that needs treatment right now.
Exactly. But if active disease is diagnosed, based on the whole picture, prompt antibiotics, usually doxycycline, lead to an excellent prognosis for the straightforward joint cases.
But much more guarded or even poor if those kidneys are involved.
Which is why prevention is just hammered home in all the sources. It's the most effective thing.
Combining those tick control products, the topicals, orals, collars, with doing those daily checks yourself.
And quick removal if you find one, well within that 24-hour window, ideally. Plus, vaccination as an extra layer if you're in a high-risk zone.
So by digging into these specific sources you provided, hopefully you feel like you've moved past maybe feeling overwhelmed to having a much clearer, more solid understanding of Lyme disease in pets.
Yeah, the core facts, the nuances, what really matters.
And maybe this leaves you with something to think about. Given that diagnosis isn't always black and white, with those vague symptoms and the tricky interpretation of positive tests, how do you, as a careful pet owner, especially if you are in one of those risk areas, find that right balance?
Right, the balance between being vigilant, watching for subtle changes in your pet, versus, maybe over-interpreting a test result or jumping to conclusions. It's a fine line to walk sometimes. What feels like the right approach for you in your situation?
Something to definitely consider. Thank you for bringing us these sources and joining us for this deep dive today.
Yeah, thanks. Good conversation.